A young woman, Maya, 20 years old, struggling with depression and sleeping problems, joins a therapy group that I run in an outpatient unit in psychiatry at Aalborg University Hospital. Maya comes in with a skeptical attitude. She doubts that music listening will do anything good for her. The name of the group is Sleep with Music. Maya has sleeping problems. She wakes up several times during the night and it takes her hours to fall asleep. Those hours are full of frustration, stress, restlessness, and negative thoughts about the night ahead. Even if Maya is skeptical, she is also a kind of pragmatic person. So she decides, that she's going to test if music can be of any help to her. I, the music therapist, introduce music for sleep by playing examples of calm music from the Music Star app. This is an app designed by me and a very good colleague, Lars Bertelsen. The music is slow, calm, predictable, the melodic line is clear, it is instrumental, the harmonic textures are simple and recognizable. I introduced the idea that music can act distracting. The function of the music can be distracting, so the music helps the mind focus onto the music and away from thoughts or restlessness. I understand Maya. If music, of all things, would be of any help, would she not have known about it or even thought about it herself? Many young people listen to music every day and they are very aware of how music affects them. They play stimulating music to exercise and they play energetic music for parties. They also have playlists of comforting music that they are using for low moods or difficult days. Young people are used to using music for arousal regulation and also for affecting the mood. So why not music for sleep? One of the reasons that it takes a music therapist to guide the use of music for sleep is that most of the music that we listen to normally is simply too stimulating for sleep. Music with lyrics activates the cognitive functioning, and this is not helpful to sleep. It takes time and effort to get familiar with bedtime music, and it also takes an effort to make it work. In the group members are playing examples of the music pieces that they have found on their mobile phones that they're going to use for their sleep playlists. And to Maya, this music is simply so different, and she cannot identify with it. So when she's asked to play her preferred music piece, she plays a piece by Five Finger Death Punch, which is heavy metal. So another group member suggests to her perhaps finding a cover version or an acoustic version that may be more appropriate for sleep. In between sessions, Maya does invest time searching for appropriate sleep music using the suggested features, and she comes back into the group and she is surprised. It seems to work most nights. She still wakes up several times during the night. But now she falls asleep with music within 1 hour instead of 2 or more. And she reports feeling less stressed when going to bed. She starts with a sleep routine using music, and the following week she reports that music listening at bedtime makes her less stressed. It improves her sleep quality. She falls asleep faster, and she feels better rested during the day. This is important. Sleep is important. She also reports of using music during the day. Maya works in a nursing home, and she experiences problems of overstimulation and also of extreme tiredness. She goes to her boss and she asks for permission to take a few extra breaks during the day. And in these breaks, she goes to a quiet place and listens to music. In this way, she avoids overstimulation, and she also gets to recharge batteries. In this way, she can actually stay at work, and she does not need to take sick leave or to go home early. So this is very important, and this is a good example of how music listening, simply music, can make a big difference in the life of a young woman struggling with depression and sleeping problems. Now, the effects of music for sleep has also been investigated in research. An article, a Cochrane review by Jespersen and colleagues, looked at 13 studies, investigations of music effects in insomnia populations. The studies included more than 1,000 participants, and they have been listening to pre-recorded music for 25 to 60 minutes in periods ranging from 3 nights to 3 months. The study results showed overall positive effects on sleep quality for the insomniac people. In my PhD study, I investigated the effects of music on sleep quality in depression-related insomnia. We included 102 participants and randomly assigned them to control group and music intervention group. This were patients in depression treatment in an outpatient unit for depression in psychiatry at Aalborg University Hospital. The participants listening to music were instructed to listen to music for 30 minutes at bedtime for 4 weeks using a sound pillow and the Music Star app. The Music Star app is an app made by music therapists with 16 playlists, color-coded, curated by music therapists. The app allows for both the preference of the user and also the expertise of the music therapist. We tested the groups looking at sleep quality, depression symptoms, and quality of life, and we used very well-known questionnaires. We tested them at the beginning at 4 weeks and then 8 weeks, and comparing groups at 4 weeks, there were positive effects of music listening in sleep quality and in quality of life. Comparing groups, we saw no difference in depression symptoms. The study concludes that music may be effective in improving sleep quality in depression-related insomnia. Yes, so music seems to work. But how? There are neurophysiological and psychological effects. Slow music decreases the heart rate and the respiration rate. simple and predictable music calm down the nervous system. Considering psychological effects, there's an interplay of music, body, and mind. And this is a little bit complex, so we wanted to know more of individual experiences, and we interviewed 4 of the participants from the study. One woman told us that she didn't benefit from the music intervention at all. She was used to listening to an audiobook at bedtime, and that was helpful to her. Her testimonial is important. Bedtime music is simply not for all. Another woman reported very positive effects of music listening, and she said music distracts from thoughts, from restlessness, from pain. She reported music having positive effects on her mood and also on her bedtime routine. She said she even got ready for bed earlier because she was looking forward to listening to the music. She said, "It can give you a complete sense of happiness." I was really looking forward to listening to the music because I knew I would get peace of mind. So yes, it has really been nice. She also said, "I felt differently rested in another way in a shorter time than previously." So these 4 interviews gave us examples of very varying use of music and highly individual reasons for choosing and using music. Music can replace sleep medication. Health authorities today are not any longer recommending sleep medication because of negative side effects. Music does not have negative side effects, and there is no prescription needed for music. This is an important message. The use of music in the everyday life of many young people indicate that music listening for sleep may easily be introduced and accepted. Music is a powerful self-help tool. Music is safe, it is accessible, it is simply easy to start with. We need to spread the word about this. I will, and Maya certainly will too. Now please, lean back, take a deep breath, and listen to 1 minute of the piece Be Here Now by Christian Thorsager. Thank you.